Okay, so good morning. Welcome to our first Third Thursday Continuing Education Members Matter program of 2024. So we have everyone joining us through Zoom today. And I hope that you are all staying warm and well. It has been an interesting January so far. To ensure that everyone has the best experience possible, we ask that during the presentation, you make sure that you're muted, make sure your camera's off, put any questions or issues you have in the chat, which will be monitored by staff. And please rename yourself as either your first and last name or your first name and your library. And then each of these portions will be recorded separately. And then for the Members Matter portion of the morning, we will be giving updates from IHLS and share departments and invite your questions and comments. We invite you to turn on your cameras and unmute yourself to ask questions or provide comments because we'll still be monitoring the chat. So now I'm going to turn it over to Jill Trevino to introduce our topic and our speaker this morning.
Great. Thank you so much, Kate. Appreciate all those housekeeping items. So I am very excited to be able to welcome today's presenters from LIMERiCC. We've got Ashton, who's going to be going through the presentation about who LIMERiCC is and what they have to offer. So LIMERiCC is an option that allows us as Illinois libraries to pull together to offer a more robust benefits package. So Ashton will be covering all of that information today, and we also have Margie on the line, which Margie will be able to answer any individual questions at the end of the presentation, as well as Ashton, to cover more of what LIMERiCC is and how you can become part of that benefits package offering. As many of us know, we've got a lot of smaller libraries that maybe not are able to go ahead and offer a bigger benefits package. So this is a way for all Illinois libraries to pull together. So I'm going to go ahead and turn it over to Ashton and go from there.
Thank you, Jill. All right. Let me go ahead and share my screen. 1 second here. There we go. All right. I think everyone should be able to see me now. So like Jill said, my name is Ashton Harnong. I'm just going to give sort of a brief presentation about LIMERiCC, what LIMERiCC is, what plans are offered through LIMERiCC, how, if you are interested, how you can apply for membership. And then we will have a little Q&A session at the end. If you have questions throughout the presentation, do feel free to pop those into the chat and we can address them at the end as well. So we'll start with what is LIMERiCC. Jill already did a great job of this, so I'll just kind of briefly recap. LIMERiCC is a cooperative that's established by like entities, so libraries, public libraries, that allows those public libraries to come together to purchase goods and services. LIMERiCC has sort of two components to it. The first is the UCGA, which is the unemployment cooperative, and they also have HIP, which is the health insurance program, or the program that allows libraries to band together to purchase insurance. For today's discussion, I will focus on HIP, but if you have questions about UCGA, Margie will be able to answer those as well at the end. So the main goal of HIP is to improve bargaining power within the marketplace when purchasing health insurance that you may not have as an individual library. Again, the larger that your population is, the more bargaining power that you have. And so by pooling all of these sort of smaller libraries together, that improves that power within the marketing place. The objective is really to reduce cost because, again, we have a larger risk pool while retaining competitive benefits. So again, we're kind of spreading that fixed cost because we do have a larger risk pool or a larger population, and we're reducing risk because those claims are going to be spread among that larger population. What are the benefits of participating? So there's a few nice perks. The first being really that you get to offer that robust benefits package, and we'll go into that what that looks like in detail. But here's some kind of additional perks. You get access to a free benefit resource site, and you're welcome to visit that site today. It's just limerickbenefits.org. This screenshot here on the side is just a snip of what that page looks like on the landing page. So when you log on to that landing page, we do have a benefits overview presentation. So for our member libraries, that's a really nice way to give access to an open enrollment presentation at each year at open enrollment. They also use this throughout the year for their new hires. So it kind of alleviates some of that lift for you, where you don't have to sit and give a benefits presentation, because I know you all are wearing many, many hats. So let us be the benefit experts. We'll explain benefits for your employees through this pre-recorded video. The site also has benefit guides. It has information for you as the administrator. It has who members can reach out to if they have questions about their benefits. It also has information on new membership. So if you are interested in applying for membership after today's presentation, that website is going to be a great resource for you. And it also has access to Benefit Hub. So Benefit Hub is, again, just a nice little perk where anyone who is a part of LIMERiCC can log on. There is a little access code that they receive, and they get access to all kinds of discounts, and not just benefit discounts. There's discounts for homeowners insurance. There's discounts for car insurance. There's shopping discounts. So it's a nice thing for employees to be able to access, and it's just an additional perk. You don't have to pay anything extra for it. Libraries who participate in HIP also have access to the Employee Navigator enrollment system. So rather than your employees having to fill out enrollment on paper, they could potentially be given access to Employee Navigator, where they would just enter in their election choices each year at open enrollment or when they're a new hire. And that information would feed over to the carriers to automatically have them enrolled. We do have some member libraries that say, you know what, my employees are super comfy with paper and we want to keep it that way. That's totally fine. Your employees can still fill out a paper form. They would submit it to you as the library director or HR, and then you would enter that information into the Employee Navigator system. So again, that just feeds right over to the carriers. It makes things very seamless and easy. You would work with Margie, who would provide you an invoice for your benefits within HIP. So again, you're not having to track down benefit invoices from all those carriers. Margie really takes care of that for you, and she does a great job. And then she's also your single point resource for any questions that you have about your invoicing or in your enrollments. We provide free HR benefit education seminars or webinars. We know you guys are coming from all over the state, so we give access to these virtually, so you can join if it suits your needs, if the time works for you. We're doing one this month, just talking about how member libraries can really sort of learn to save money with their benefits and give their employees a really nice option where employees aren't losing benefits. We provide employee benefit communication materials. So like I said, they will get access to benefit guides. If you ever needed suggested language on an open enrollment memo, we have resources for that. So we provide all that information. Oops, sorry, my slides must be on a timer here and I'm taking too much time. Assistance with compliance requirements. So if you have any questions about ACA reporting, I know that's a big one this year because the IRS has changed the rules, and those who are much smaller, who in the past have been able to file their ACA forms via paper, now have to do it electronically. We can assist with those requirements. We have resources that can help. Any questions that you have, we're happy to help with. And then there's also some wellness initiatives that LIMERiCC has taken on this year, which is nice. I know sometimes as a smaller library, you may not be able to provide wellness programs for your employees, but through LIMERiCC, you can. So they do a virtual wellness fair each year. That's a really nice perk. Again, it's all virtual, so it doesn't matter that you're spread across the state. Your employees can log on to that virtual wellness fair. It's just a website, and they can participate in the different presentations. They can they can play around with what resources they have available to them. And then what we have done in the past is that if they log onto that virtual wellness fair website and they participate in the wellness fair, they can enter their information to be entered into a raffle. And the prizes were pretty nice. Lots of, virtual gift cards and things of that nature. So, not sort of chintzy prizes. There's also an initiative, and this is for anybody who participates. So any of your employees that are enrolled in medical coverage through LIMERiCC, they could, if they choose, participate in the wellness incentive. And so what that requires is they complete a biometric screening through either their provider or through a Quest Diagnostics center. And they log on to their Aetna portal and they complete a health risk assessment. And if they do both of those things, they're eligible for a $50 gift card. And that gift card, there's a list of about 300 places that they could choose to get that gift card to. So a really nice option for them. The other nice perk about this wellness incentive is that if I'm an employee of your library, I participate in the medical plan, and my husband also participates in the medical plan, my spouse would also be eligible to complete a biometric screening and an HRA and get that $50 gift card incentive. So in total, me and my spouse could receive up to $100 in gift card incentives just for participating in that wellness initiative. The data doesn't get sent to LIMERiCC or the libraries. Everything is still private for your employees. Really, that is just a push for employees to know their numbers so that they can stay well throughout the year. So like I said, the number one benefit of participating in the HIP program through LIMERiCC is that you have the opportunity to offer a really robust benefit offering for your employees. And so let's talk about what can be offered through LIMERiCC at this time. So the HIP medical plan offerings, there are 4 options. You can choose. This is like a menu. You can choose 1, you can choose 2, you can choose all. And then your employees would get to choose what plan they'd like to participate in. So there's lots of flexibility here. There's, again, 4 plan options. The first is an HMO. The HMO through Aetna is not like a traditional HMO. You don't have to select a PCP to participate in this HMO plan. However, you do need to make sure that any of the providers that you're using are in network, because there's no out-of-network coverage on this plan. There is a small deductible of $100 for a single and $200 for a family on the HMO, but that's really only going to come into play anywhere that there is not just a flat copay. So you'll see, for instance, physician services, which is just a PCP office visit, that's just a $30 copay. Your members don't need to meet their deductible for that copay to come into play. So day 1 of the plan, they pay that $30 copay to see their doctor, and that's all that they need to pay. The deductible really only comes into play for, say, an inpatient hospital admission. So they would pay a $150 copay, plus they'd pay their deductible. So again, that deductible is really minimal, and it only comes into play for things like inpatient hospital services, where they're kind of outside of a doctor's office. If they want to see a specialist, so that's anything that's not a primary care provider, I think of them as ologists, right? Any ologist visits, office visits, would be a $40 copay. They'd have a $150 copay to use the emergency room. And all of those copays and deductible and coinsurance, that would all accumulate toward the out-of-pocket maximum, which is $1,500 for a single and $3,000 for a family. Once your member meets that out-of-pocket maximum, their services are going to be covered for the remainder of the year. The nice thing about this plan as well is that these out-of-pockets and deductibles, they're embedded. So what that means is that if I have myself, my spouse, and my child all enrolled in this plan, and I have a lot of services this year, but my spouse and my child do not, I only need to meet the single deductible and out-of-pocket maximum. I don't need to meet that full family for my services to be covered. So if I meet $1,500, my services will be covered for the remainder of the year. But let's say, then my son breaks an arm, then he would need to meet his own individual deductible and his own individual out-of-pocket. But as a family, we would never need to meet more than the family deductible and the family out-of-pocket. So that's what embedded means. There is a separate prescription drug out of pocket for the year. So all of my prescription drug copays would accumulate toward this separate bucket of $1,000 for a single and $3,000 for a family. But again, my prescription drugs, day one of the plan, I'm just paying a copay on those. So depending on what type of drug, if it's a generic or a brand or a specialty, my copay will differ. The next plan option, sorry about that. I don't know what's going on with my slides here. The next plan option is the $750 PPO. So this is the richest traditional PPO plan. Again, there is a deductible. It's $750 for a single and $2,250 for a family. That deductible is embedded. So again, if you're a single person within a family, you only need to meet that single deductible. Again, the deductible only comes into play for certain services that fall outside of a provider's office. So again, an inpatient hospital admission, you'll pay a copay plus your deductible and coinsurance. But if you're just seeing your PCP or an ologist office visit, you'll just pay a $30 copay or a $40 copay, depending on that type of provider. For the emergency room, you'll pay a $100 copay. And again, all of those copays, deductible, coinsurance, that's all going to apply to the out-of-pocket max of $1,750 for a single and $5,250 for a family. You do also have out-of-network coverage on this plan. I won't go into detail on the out-of-network because we like to encourage folks to stay in network. That's where the employees are going to get the best bang for their buck. So we really like to encourage folks to stay in that in-network tier. There's also that separate RX out-of-pocket max on this plan as well. It's the same, $1,000 for a single, $3,000 for a family. And again, all of the prescription drugs are going to be based on a copay, which matches the type of drug that it is. So a generic, a brand, or a specialty. The next plan option is a little bit less rich of a traditional PPO plan. It's the $1,500 PPO plan. So the deductible and the out-of-pocket are a little higher on this one. You'll see it's $1,500 for a single, $4,500 for a family. But it pretty much functions the exact same. The only difference is that the deductible is higher and the out-of-pocket is higher. The out-of-pocket for a single is $2,500 and for a family it's $7,500. But you'll see the copays are actually the same. So these plans almost mirror each other. They're just going to have a little bit higher deductible and out-of-pocket on the $1,500. But again, don't forget that deductible is only going to come into play when someone's using a service outside of their provider's office. So this is a really nice option for your employees or even those libraries who may want to have a lower cost plan option. Because if you're just using, you have a few sick visits a year, or maybe you have a condition that requires you to see a specialist once a month, you're only going to pay those copays. You're really not going to pay the deductible unless you have something like an inpatient hospital stay where you would need to incur that deductible. And again, same thing here with the prescription drugs. You have a separate prescription drug out of pocket and you have copays. And the copays are exactly the same as they are on the $750 plan. The fourth plan option is a high deductible health plan, which can be paired with an HSA. The high deductible health plan is similar to a traditional PPO. It actually is a PPO. It just has a higher deductible, higher out-of-pocket max, and no copays. So this plan would require employees to pay the full cost of their services and or prescription drugs, less the Aetna network discounts, until they've met that larger deductible, which is $3,200 for a single or $6,400 for a family. Again, that's embedded. So if I have a family, but I'm the one incurring most of the claims, I only need to meet that single deductible of $3,200. Once I meet my deductible, you'll see if I'm staying in network, everything's covered after that. I don't have to pay anything once I meet that deductible. And the nice perk about this plan is that all of my prescription drug costs also accumulate toward that deductible. So they're not accumulating towards separate buckets like they are on the other 3 plans. So if I'm somebody that, has a lot of prescription drugs throughout the year, this actually may benefit me even though I'm paying a higher deductible, because everything's going to accumulate toward that same bucket. This plan can also be paired with a health savings account. I could talk for days about health savings accounts. They are a huge perk. What I will say is that if you do decide you would like to apply for membership for LIMERiCC, and this is a plan you'd like to offer, and you have questions about the HSA, or you'd like a separate presentation, I would be happy to provide that at that time, because I don't want to waste too much of your time today. One very important thing to note here on the medical: if you would like to apply for membership and you would like to offer one or any of these medical plans to your employees, these plans must be employer sponsored. And so that means that the library must make a contribution to the premium. It cannot be that this is 100% employee paid. So that's something important to note. And again, if you have questions about that, please let us know. HIP also offers dental and vision plans. So I kind of combined this slide. On the left here are the 2 dental plan options. And again, you can offer one or both of these to your employees if you would like. The first is a dental HMO. So similar to that HMO medical plan, there's in-network benefits only. There's no out-of-network benefits. And it's all going to be based on a copay schedule or a fee schedule. So, really what service your employee is getting, the cost will just depend on what that fee schedule looks like. There's also the dental PPO option, which again, very similar to a medical PPO. There is a small deductible. It's $50 for an individual, $150 for a family. And again, that's embedded. So if you're a single, you just have to pay your if you're one person within a family, you only have to pay the single deductible of $50. That deductible is going to be waived for preventive care though. So if you're just going and getting your annual preventive cleanings, you don't need to pay that deductible. And then there's a calendar year maximum on the dental plan, the dental PPO as well. So that calendar year maximum is actually different than the medical maximum. The medical out-of-pocket maximum is the maximum that an employee or a member will pay in a year. The dental PPO annual maximum is the max that the plan will pay in a given year. So what that means is that once the dental plan pays $1,000 in benefit for that member, they're going to stop paying for the rest of that plan year, and the member would be responsible for anything above and beyond that annual maximum. And what your employee or your member would pay would depend on the type of service that they're having and the provider's office that they're receiving it at. So in network, again, we like to encourage folks to stay in network, and that's because in network, those providers have negotiated contracts with Aetna where they say, Aetna says you can't charge more than X amount. So they're going to get the best bang for their buck if they stay in network. Now, of that negotiated amount, based on the type of service that it is, Aetna will pay a certain percent. So if it's a preventive service, Aetna's going to pay 100% prior to deductible. Okay, we want to encourage people to get their preventive dental care. It's going to be fully covered. For basic services, so these are things like fillings, that's going to be covered at 80% of the allowed amount. So the provider is going to charge that negotiated amount. You're going to pay the deductible, and then you'll be responsible to pay 20%. The provider will pay 80%. And again, that's up to that $1,000. So once the carrier has met that $1,000 annual max, you would be required to pay the balance. And then major services, those are things like crowns or sort of the major dental service, that'll be covered at 50%. So again, you'll pay the deductible, then you'll be required to pay 50%. Aetna will pay the remaining 50% until they meet their $1,000 annual maximum. There's also orthodontia coverage on both of these plans. Again, the dental HMO will cover both adults and children, and it'll be covered at a copay, so a scheduled fee. On the dental PPO, Ortho is only available for your dependent children to age 19. And there is a $1,000 maximum. That is a lifetime maximum. So that maximum doesn't reset every year like the dental annual max. They just say for the lifetime of that member, we will pay $1,000 toward their orthodontia coverage. And orthodontia is covered at 50% on the dental PPO. So much like major services, you'll pay half of the cost of the ortho. The carrier or Aetna will pay the other 50% until they've met that $1,000, and then you would be responsible to pay the remaining balance. Again, we don't encourage folks to use out-of-network providers on the dental PPO plan, and that is because those providers have not entered into a contract with Aetna, and so they could charge any amount for those services. They haven't negotiated a cap on what they can charge for certain services. And so what tends to happen is that folks get stuck with what we call a balance bill, where they have to pay the provider the remainder over what Aetna will allow. There's one vision plan offering within HIP. And again, there's in and out of network coverage, very much like dental. We encourage folks to stay in network because out of network, they usually get hit with a balance bill. So we don't like to see that. But the plan allows for folks to get an eye exam once every 12 months. They can replace their lenses once every 12 months, and that would be contact lenses or lenses for their glasses. And they can replace their frames every 24 months. So for instance, I wear both glasses and contacts. If I choose, I can get my frames every other year. And then the years where I'm not getting my frames, I can say, you know what, I need new lenses for these glasses. Can we switch them out? Or let me have my contact lenses covered. That doesn't mean that you can't get both. So with the plan, you do get some additional discounts above and beyond the benefit. So for instance, if it's a year where I want new frames and I'm getting new lenses for my frames, but I also need contacts to get me through the year, I can have my frames be covered under my benefit, and then I can get a discount on my contacts. So it's a nice perk, lots of discounts available. Eye exams are covered at a $20 copay. And materials, so that means if I'm getting new glasses, I don't need to pay an additional copay for those materials. Once I get my eye exam, that copay kind of covers me getting my materials. Then VSP gives an allowance toward your materials. So if I pick out a pair of frames that are $200, VSP is going to give me $120 allowance toward those frames. So initially, I'll just take $120 right off the top. That leaves me with an $80 balance. They're also going to say, you know what, we'll give you 20% off of that $80 balance. So really, it's a nice perk. I get some good discounts on my glasses. For contact lenses, they give a $120 allowance as well with no additional discount on the balance. So I can get $120 toward my contacts. If I have medically necessary contacts, those will be covered in full. But I do get this question sometimes. Just because you have a prescription does not mean that your contacts are medically necessary. What that means is if you have a condition where you absolutely cannot wear glasses, you need a corrective contact lens for that medical condition, that would be considered a medically necessary contact lens. And again, you do have out-of-network benefits, but VSP will only pay up to a certain amount, and then the member would be stuck with the balance. Okay, some additional benefits that are offered through HIP. The first is basic life and AD&D. If you are a member of LIMERiCC and you're offering benefits to your employees, this is required to be offered to all full-time employees. You can't, just pick and choose who it's offered to. It is a $30,000 benefit. It's a nice benefit. So if something were to happen to your employee, that benefit would pay a flat $30,000. There's also AD&D included on that benefit. Not the most fun thing to talk about. It's accidental death and dismemberment. But if, for instance, one of your employees were to pass away in a car accident, they would get that their beneficiary would get their $30,000 basic life benefit and they'd also get a $30,000 AD&D benefit because their death was due to an accident. So again, not the most fun benefit to talk about, but it does help to cover your employees and help their beneficiaries if something were ever to happen to them. Voluntary life and AD&D is also available. And this allows your employees to purchase additional life insurance on top of that basic life benefit for themselves, their spouses, and or their dependents. They have to elect for themselves in order to elect for their spouses or their dependents. And this allows them to elect incrementally. So they can elect in increments of $10,000 for themselves up to a max of $300,000. For their spouses, they can elect in increments of $5,000 to a max of $150,000. And for their children, they can elect in increments of $5,000 to a max of $15,000. There's also 3 worksite, they call them worksite benefits. They're just additional voluntary benefits that employees could choose to elect that they would need to pay for. The first is voluntary accident coverage. So this will just pay your employees a specific dollar amount for a variety of covered accidents. So let's say, for instance, they step off the curb, they roll their ankle, and they have to go to the hospital because it's broken. For a fracture, that plan would pay them a certain flat dollar amount. They can use that money to help pay their copay if they are in the emergency room and they need to pay that copay, or if they're on the high deductible plan and they have to pay toward that large deductible, they can use the money for that, but they don't have to. Let's say they're fine paying their emergency room copay, but they might need that money that their voluntary accident plan paid them to help them cover rent this month or to buy groceries. They can use the money for whatever they want. This just pays them a flat dollar amount, and they can use the money however they see fit. Voluntary critical illness will do that same thing. It'll pay them a flat benefit or a flat dollar amount if they're diagnosed with a covered critical illness or a covered condition. So we see a lot of cancers on this plan, things like that, heart attacks even. And so if they are diagnosed with that covered condition, they would submit a claim form and the plan would pay them just a flat dollar amount. I believe it's either 10 or 20,000. I could be wrong, but it pays them a pretty significant amount. And again, they can use that money for whatever they want. They can use it to pay rent. They can use it to purchase groceries, they can put it away in savings. They can use it to help them pay their deductibles and out-of-pocket maximums. As we know, these conditions can get really costly. So this is a nice benefit to have for those members. Really, really important though, if somebody has already been diagnosed with one of those covered conditions and you become a member and they enroll at this time, that would not be covered. So it's only for a newly diagnosed condition. And then the voluntary hospital indemnity plan. This is my favorite plan. I personally enroll in voluntary accident and voluntary hospital indemnity because this will pay a flat benefit for hospital admissions and confinement. And the reason I love this is because I'm still at the age where I'm having children. And so when I'm admitted to the hospital for having a baby, this plan literally pays me to have a baby and stay in the hospital. Again, it just pays that flat benefit. So you can use that money to help pay down a deductible. You can use it for whatever you want. But it's not just for having babies. Truly, if you are in an accident and you need to stay in the hospital for a few days, it will pay for that as well. So any type of hospital admission or confinement, this plan would pay for. Okay. Let's talk about how to apply. So if any of that has interested you and you're thinking, I would really like to apply to be a member of LIMERiCC so that my employees can get these benefits and we're able to offer them. There's a couple of requirements to apply for membership. So we're always working in advance. So in order to apply for January 1st of 2025, I cannot believe I'm already talking about that date. There are 3 required documents for submission. The first would be a health risk assessment. What that means is it's just a disclosure of any of your employees that may have potentially high claim cost conditions. Now, we know if you're a smaller library, you may not know for sure what conditions your employees have, right? You're not really necessarily getting claims data on them, but you may know, for instance, oh, I happen to know that this employee has taken time off because they have cancer, or this employee has told me in passing that they have high blood pressure. You can add those. It protects your employees. You don't have to put their names or any of their personally identifying information. You're just disclosing to the carrier, hey, I know we have XYZ condition within our population. So again, you don't need to worry about disclosing your employees' personal information, and it's just to the best of your knowledge. If you don't know, then you don't know. So you don't need to put that information on there. The second piece is the employee census. So that will include all of your benefit eligible employees, even if they choose to waive coverage. So if you're currently offering benefits, but 2 people don't take them, you need to include them anyways and just say that they waive coverage. It'll also include any retirees that are eligible for coverage and any of your current COBRA participants if you have any. The third requirement is only for libraries that have over 50 employees. If you do have over 50 employees, we would ask for the past 24 months of historical claim information as well. And just a reminder, these are for public libraries. The documents, once you've collected them, they would need to be submitted to this email address. It's mwil.limerick-eb@marshmma.com. And that would be by March 8th of this year for that 1/1/25 entry. We take those documents and we then submit them to Aetna. And Aetna will review the documents for risk. So they will review the risk of your population, and they'll assign what we call a risk score to your population. And this was a board decision. So the board has decided if a library scores 1 or less on Aetna's risk review, they will be eligible to join LIMERiCC. If a library scores over 1, they are not eligible to join. Now, the board doesn't know your risk score, so they have no idea what the actual risk of your library is. Aetna just tells them based on those parameters whether a library is approved or not approved. So again, you never have to worry. Nobody's personal information is being shared, not with the board, not with Aetna. At this time, it is really just a review of, let's take a look at what the risk is of this library. If you do apply, you will be informed of your status by April 19th. So Aetna will do their review, and then we will let you at the library know, yes, you're approved to join, or no, you're not approved at this time. I say at this time because you can apply every single year if you want. Risk scores do change based on, people leaving or your population changing. Maybe you hire in a few people that actually lower that risk score. So you can apply every year, even if you are not approved one year. If you are approved and you want to join LIMERiCC, confirmation would be required by May 24th of this year. And again, that is so that we can include you in the renewal and you're part of the group for 1/1/25. Really important here to note, if your library is currently self-funded or part of another cooperative that is self-funded, you may need entry for a date other than 1/1. So for instance, let's say you have a stop-loss contract that goes through June 30th, and you can only enroll for 7/1. Reach out to us at that email address and we can discuss with you. We can always ask Aetna for exceptions in the case of somebody being self-funded and completely unable to join at 1/1. All right, I am going to take questions now. I do see I have one in the chat. So I'll start there, but please feel free to chat any others in or unmute yourselves. This is a great question. So for hospital indemnity, if you are currently pregnant and pick up the plan, will it cover, or is that considered a pre-existing condition? That I would want to check the plan documents. I know specifically for the plan that I am enrolled in, if you are currently pregnant and enroll, it's not considered a pre-existing condition, but each carrier is a little bit different. So I'd like to confirm that, and I can get that information to Jill, and then she can get it back to you, Jill, the other Jill, if that works for you. Another great question, when do we find out the cost? So right now, we could give you the cost of the current benefits. Unfortunately, for 1/1/25, that will likely change because they'll be going through renewal. So we could tell you right now what that cost is. You can compare it to your current costs if you'd like. And then obviously that will change for 1/1/25, just like it would every year for every plan. Unfortunately, we don't have an estimate of how much it will change at this time, but by the deadline of May, we would have a pretty good idea of what that would look like, and the renewal is finalized in August.
Do you want me to read, Ashton, what's in the chat?
Yeah.
Somebody said, for a library with more than 50 employees, is the benefit eligible employees or all employees?
Oh, so I totally missed that question. Thank you, Jill. So for a library with more than 50 employees, it would be 50 benefit eligible employees. So let's say you have 25 employees and then 25 part-time employees. You would only be able to get claim information on those benefit eligible employees. So really that 50 is 50 eligible for benefits.
Yeah. Now that actually brings me to a question. So what do you consider full-time that is benefit eligible?
That's a great question, and it totally depends on whether you're considered an applicable large employer, or an ALE for short. So if you are considered an applicable large employer, which means that you have 50 or more full-time equivalents, you would be required to offer benefits at 30 hours a week or more. Now, full-time equivalents is a little confusing. What that means is that when you take your full-time employees plus you sum the hours worked by your part-time employees and average those out, if the average of your part-time employees' hours worked plus your full-time employees equals 50 or more, you are considered an applicable large employer.
And somebody had asked, this is more of a general question. I am covered on a city-sponsored plan, so more for the group to know. Oh, okay. That was just her question. And then it says, I think FTE total is in our IPLR. Ellen, is that total? Is that correct? The FTE total is in the IPLR numbers?
It is, Jill.
Okay. All right. And then I have a question. So I am a very small library. I only have one full-time eligible employee. Can I apply?
Yes, you can. If you have just one full-time eligible employee, you are absolutely welcome to apply. You would still need to fill out the HRA and the census with just that one employee, and we would submit that to Aetna for a risk score.
And Margie put in there about part-time eligibility. What does that consist of?
Thanks, Margie. Yep, so part-time employees, if you're approved to join, part-time employees would be eligible for dental, for vision, and for any of the voluntary benefits. We also have some locations that offer basic life to their part-time employees, but the part-time employees must pay for it. So really, you could offer the basic life or the voluntary life. Either way, part-time employees would pay for it. That said, part-time employees are not eligible for medical, unfortunately. So that is one thing to caveat that with.
Yeah, and that's carrier requirements.
Correct. Yep. And if you as a library, do not want to offer dental and vision to your part-timers, you don't have to, but it's available for you too.
Okay, great. What about an EAP?
There is an EAP, thank you. That is available through the life insurance benefit. So again, if you're offering life, that EAP is available. The nice thing about the EAP is members don't really have to be enrolled. All that they need to do is identify that they're a part of LIMERiCC. So it gets a little confusing. The way that it functions is they would have to identify as an employee of LIMERiCC, even though we know that that's not true. But that's what's recognized in the carrier system. So they just say, I'm an employee of LIMERiCC, I'm part of LIMERiCC. They would be able to access that EAP benefit as well. The other nice thing is, if you as a library, it seems like in the past few years, we've had some traumatic events happening at public places. So, at libraries, at schools. And so EAP services are being consumed by our public employers much more frequently. So if something traumatic happens and you'd like to provide services to your employees, there is an additional cost, but you can access the EAP resources to do so. So if you wanted to have somebody come out to assist your employees with that trauma, you can do that at that time.
Great, thank you. And I've got another question here. Can people COBRA this insurance if necessary?
Yes, absolutely. So COBRA is available for medical, dental, vision, just like everything else. If somebody is enrolled and they terminate for any other reason besides gross misconduct, they would be offered COBRA. And that is to note that their employment terminates. If they just drop the coverage in the middle of the year, that would not be a COBRA eligible event. That is also managed by the cooperative. So the nice thing is you don't really need to be involved. That COBRA would be offered, and it would be offered for 18 months in most circumstances.
Okay. Another question, does your risk score every year get reevaluated? Or if you have a year of collective high claims by employees, are you not penalized for that?
That's a great question. Thank you for bringing that up. So if you are already approved to join LIMERiCC and you accept membership and you join, your library's risk score is not reevaluated every year. So you'll never be booted or penalized or even asked to, let's say your library specifically has a high claims year, you're never asked to make good on those claims. Essentially how it works is there is a shared risk. So you're going to pay in the premiums that you owe. If you have a year where your claims are higher than the premiums that you've paid, you're never asked to pay the difference. That's going to come out of reserve. So the LIMERiCC reserve really helps to protect you as a library from ever having liability on those claims. You're just asked to pay that flat premium amount, and you'll never be penalized if you have a high claim year.
I do not have any other questions in the chat. Does anybody else have anything they would like to ask Ashton? Oh, okay, Ashton. Okay, would you like to mention that we are open to new members now, but may not be in the future, Margie said.
Yeah, thank you, Margie. That's another great point. So the way that cooperatives work, Aetna will allow new member libraries to join regardless of their size. And LIMERiCC has not always been with Aetna. They moved to Aetna January 1st of 2021, which really allowed them to open up membership because it allowed for, as you all know, many libraries don't have more than 50 employees, or usually it's significantly less than 50 employees. So it's very difficult for libraries to join a cooperative when they weren't with Aetna. Prior to that, LIMERiCC was with Blue Cross Blue Shield, and Blue Cross Blue Shield has very stringent rules on membership. And so they actually require a much larger population in order to be able to join. So it really kind of kept libraries from being able to join. So right now we being LIMERiCC. LIMERiCC is with Aetna. So it allows for smaller libraries to apply freely. At some point, LIMERiCC may move back to Blue Cross Blue Shield. We don't know if or when that will happen. They are very happy with Aetna, but As you know, we're marketing when we need to. And so if if Limerick ever moves back to Blue Cross, that would prevent many small libraries from being able to even apply for membership. So something to consider if you are thinking about applying, you can always apply and you don't have to join. So, if you're thinking about it, it may be a good time to just apply and see if you would be approved. And you can make that decision a few months from now. But just know that in the future, membership may not be as open just based on the carrier.
Yeah, that's a great point, Ashton. And I would definitely encourage members to apply because, like you had mentioned, you always have the option whether or not you want to take it or not. But it's good to know that you actually have an option.
Absolutely. And thank you, Margie, for bringing that up.
Okay, I don't have any other questions. Does anybody else have anything? Okay, otherwise, Kate, I think we can put it back to you. So thank you, everyone.
Yeah, thank you. We'll leave it open for another couple minutes to see if anybody has any questions. Otherwise, the recording will be sent out to all participants or all registrants and put on our YouTube page, and the slides will be shared in the L2 event. So it is 10:52. So I am going to call for a short break so we can start our Members Matter meeting at 11. So if everybody would like to get a drink, grab a snack, we will be back here in 8 minutes and start our Members Matter portion. So thank you all, and we'll see you again soon.